Exclusive interview.
Welcome, dear listeners, to this special interview on Ifrikya FM. Today, we turn our attention to the Democratic Republic of Congo, where an Ebola outbreak in the south has tragically claimed 31 lives out of 38 confirmed cases. In response, authorities have launched an urgent vaccination campaign in Kasai, and the World Health Organization announced the arrival of 45,000 doses to Kinshasa in the coming days, along with vital supplies to support treatment efforts. To help us better understand the situation, we are honored to welcome Dr. Otim Patrick Ramadan, Program Area Manager for Emergency Response at the WHO Regional Office for Africa. Thank you for being with us, Doctor.
Thank you very much for having me, and good morning, greetings to the listeners.
Thank you. Dr. Otim, can you give us an update on the current situation in Kasai and the scale of the Ebola outbreak? How serious is the situation right now?
Thank you very much. So, yes, the Ebola situation in Kasai continues. To the last report from the national authorities, we now have 47 confirmed cases. Out of these 47 confirmed cases, we've had 25 deaths. So we a case fatality ratio of 53%. So as you see, the disease is a very serious disease, usually with a very high case fatality ratio. We have a big geographical expansion of the outbreak. The response efforts are slowing and containing it. So currently it remains in one district, the district in Kasai. So Kasai province has 18 districts. So the outbreak is localized in one district of Bolape. And even within one district, it is really 6 health areas which are affected within the district. So far, we have also had some good progress. We had 2 patients that have recovered and were discharged. And then we have currently 20 patients that are hospitalized that are being managed at the treatment center.
So we understand the vaccination campaign is underway. How critical is this step in containing the spread, and who will be prioritized?
Thank you. So the vaccine, yes, is a very important tool. It's good to clarify that, for instance, we have different types of Ebola virus. The one causing the outbreak in Kasai is called the Ebola Zaire species, and for it we have 2 approved vaccines. There is one which is made by Janssen, which is not good for response because it requires 2 doses. And then the one that we are using now, which is called the Ervibo vaccine, which is a single-dose vaccine. And this vaccine is given to the contacts, so the people who came in contact with a confirmed case of Ebola, and then the people around them, and the frontline healthcare workers. So we started the vaccination on the 13th of September, and then now we have already vaccinated 1,740 contacts and the frontline healthcare workers. This vaccine is important in that it helps prevent people who have come in contact with the Ebola cases from developing the disease, and it also helps protect the healthcare workers. So the immunity is usually by day 10 after the vaccination. They have already developed sufficient immunity to fight off the infection. So it's a very effective vaccine, and it has been very helpful in the past in stopping the outbreak. So we are deploying it in addition to other public health measures such as contact tracing, such as early isolation and care for the confirmed cases, and also community engagement, infection prevention and control in the health facilities, but also in the communities, particularly safe and dignified burial for people who died with Ebola. So those other measures are being put in addition to the vaccination.
So these are the measures that are being put in place to prevent wider transmission?
Yes, absolutely. And our focus is that we want to contain this outbreak in this wilaya or district so that it doesn't spread beyond that. We are protecting the neighboring provinces, and we are protecting the neighboring countries. And we are very glad that with the comprehensive response of the government and the partners, since it's now 18 days since the outbreak was declared, we have not seen any spread beyond the original district that was affected. And we want really to hope and work very hard that we keep it that way.
The WHO has delivered additional supplies.
Yes.
They announced the arrival of 45,000 doses to Kinshasa in the coming days.
Yes. They have been arriving. So the last batch is supposed to arrive today. They were arriving in batches because the 45 is too big to be shipped. So they started arriving on 19th, 20th, and then we expect the last batch to arrive. Already in the field, we have 4,000 doses that have been taken to the field. So once we have the issues of cold chain sorted, we will move more of these doses from Kinshasa to the field. But we have also been delivering supplies for infection prevention and control so that the healthcare workers are better protected to be able to provide care for the patients.
Do you have any message concerning this situation? Do you want to send any message?
Yes, thank you. So the outbreak is occurring in a very hard to reach area. Access is challenging, and it's a very expensive operation. So the WHO last week did launch an appeal to help us to support the government response. So it's important that at this point, when healthcare workers at the front line in Kasai are responding so that we control the outbreak, that the global community stand in solidarity with the DRC, that we support the response that's ongoing so that we can control the outbreak. So we have, as WHO, an appeal that we've made for $21 million to support the national response. The national budget is $72 million because this response, as you know, for Ebola is a very resource-intensive exercise. So that is my first message. The second one is that over the years, we have really developed a lot of experience and expertise on how to manage such outbreaks. We are able to work together with the experts in DRC to do that. So we just ask that as a global community, there is solidarity and there is support and goodwill towards the people of DRC, and we are hopeful that we will be able to control this outbreak soon enough.
We hope for the best.
Yes.
Thank
Inshallah.
you. Thank you, Dr. Otim Patrick Ramadan, for your insights. We will continue to follow the development of the Ebola response in the Democratic Republic of Congo closely. This was Amira Dekhili. Thank you for listening. Thank you very much, sir.
Thank you.